Have you ever wondered what happens during a root canal procedure? It's a common question, one that often rides shotgun with a sense of apprehension and a dash of dread. The term root canal alone has been known to send shivers down the spine. But let's take a moment to remove the cloak of mystery and the accompanying fear that shrouds this dental procedure. First things first, let's address the elephant in the room, the misconceptions. There's a widespread belief that root canals are the harbingers of excruciating pain. Many people imagine a scene straight out of a horror movie. But the truth is, the procedure itself is no more uncomfortable than getting a filling. In fact, a root canal is typically performed to relieve pain caused by severe tooth decay or infection. It's like the knight in shining armor of dental procedures, swooping in to save the day, or more accurately, to save your tooth. Another misconception is that a root canal kills the tooth. Not true. In reality, it cleans and disinfects the inside of the tooth, allowing it to function normally again. It's like your tooth's personal cleaning crew, getting rid of the bad stuff, so your tooth can get back to doing its job. Now, onto the main event, the root canal procedure itself. Often, the mere mention of the term conjures images of a complex, intimidating process. But it's not as terrifying as it sounds. It's a routine procedure performed by endodontists, the superheroes of saving teeth, and it's done with precision, care, and the goal of making your toothache a thing of the past. In this video, we're going to break down exactly what happens during a root canal step by step. We'll walk you through the process from the initial X-ray to the final filling, shedding light on each stage and dispelling any lingering fears. Now, let's demystify the process and take you through what really happens during a root canal. It's time to replace fear with knowledge and apprehension with understanding. So, buckle up and let's dive into the fascinating world of endodontics. First off, why would you need a root canal in the first place? A root canal is usually necessary when there's an infection or damage to the nerve tissue inside your tooth. This could be caused by a deep cavity, a cracked or fractured tooth, or an injury to the tooth that affects the pulp even if there's no visible crack. So, what are the warning signs that might indicate you need a root canal? Persistent toothache is one. You might experience severe pain when chewing or applying pressure to the tooth. Increased sensitivity to hot or cold temperatures that lingers even after the temperature stimulus is removed is another sign. Swelling, tenderness in the nearby gums, or darkening of the tooth could also be symptoms. In some cases, a pimple-like abscess may form on the gums, indicating an infection that could require a root canal. If these symptoms sound familiar, you might be in need of a root canal, but don't worry, it's not as scary as it sounds. Now let's get into the nitty-gritty. What happens during a root canal? The process begins with the most important step, pain management. The dentist will use local anesthesia to numb the area around the tooth. This ensures that the procedure is as comfortable as possible for the patient. Fear of pain is the number one reason people avoid root canals. But with modern anesthetics, the process is usually no more uncomfortable than getting a filling. Once the area is numb, the dentist will place a dental dam around the tooth. This is a small sheet of rubber or vinyl that isolates the tooth, keeping it clean and dry during the procedure. The dental dam also protects the patient's airway, preventing any small instruments or debris from accidentally being swallowed or inhaled. Next comes the creation of what dentists call an access hole. This is a small opening made in the top of the tooth. The dentist will use a special dental drill to create this hole. If you're worried about the sound of the drill, don't be. Remember, the area is numb and many dentists use drills that are much quieter than they used to be. Through this access hole, the dentist can reach the pulp chamber and root canals of the tooth. The pulp is the soft tissue inside the tooth that contains nerves and blood vessels. When this pulp becomes infected or inflamed, it can cause a lot of pain. That's why it's so important to get a root canal when needed. In the first part of the procedure, the dentist will use small flexible instruments to clean out the pulp chamber and root canals. These instruments are specially designed to follow the natural shape of the canals, ensuring that all the infected or inflamed pulp is removed. So far so good, right? But what happens next? We've numbed the area and created an access hole. Now it's time to get to the root of the problem, quite literally. Now the dentist takes a step that's pivotal to the success of a root canal: the removal of the infected tissue. This involves using a series of small files to extract the pulp, nerve tissue, bacteria, and any decay present within the tooth. The dentist will insert these files into the access hole, working them down the entire length of the tooth to scrape and scrub the sides of the root canals. This may sound quite intense, but remember, the area is numb, so you won't feel any discomfort. Once the tooth has been thoroughly cleaned, the dentist will move on to the next phase of the procedure, shaping the root canal for filling. This is done using the same files that were used to clean the tooth. The dentist will shape the canals in such a way that they can be filled effectively. This involves widening the canal slightly to ensure the filling material can reach all the way down. After the canals have been shaped, they need to be cleaned once again. This is to ensure that any remaining debris is removed. This is typically done with a series of washes, including a sodium hypochlorite wash, which helps to kill any lingering bacteria. Now we come to a very important part of the procedure: filling the root canal. The dentist uses a rubber-like material called gutta percha. This is heated and then compacted into the root canal to seal it. Along with the gutta percha, an adhesive cement is used to ensure complete sealing of the canals. This is so nothing can get inside the tooth and reinfect it. Once the root canal is filled, the dentist will seal off the access hole with a temporary filling. This is to protect the tooth and its newly filled canal. That's it. The main part of the procedure is over. But there's still a bit more to go. You've made it through the procedure. What's next? Now that you've tackled the root canal, it's time to focus on the final steps of the procedure and the all-important aftercare. Right after the procedure, your dentist will place a temporary filling or crown over the treated tooth. This acts as a safeguard, protecting the tooth as it heals and preventing any possible infection. Remember, the root canal is only half the battle. The real victory lies in the aftercare. Your mouth might feel a bit tender for the first few days, and that's perfectly normal. Over-the-counter pain relievers are usually enough to manage this discomfort. However, if the pain persists or intensifies, don't hesitate to reach out to your dentist. It's crucial to listen to your body and take its signals seriously. Another key aspect of aftercare is maintaining good oral hygiene. Brush twice a day, floss daily, and rinse with an antiseptic mouthwash to keep your teeth healthy and your mouth free of bacteria. It's also wise to avoid hard, crunchy foods for a few days to let the treated area heal. You might be wondering, how long does it take to recover from a root canal? Well, most people bounce back in just a few days, but remember, everyone is different, and healing times can vary. It's essential to follow your dentist's instructions and take it easy until you're fully recovered. After a few weeks, you'll return to your dentist to have the temporary filling or crown replaced with a permanent one. This final step is crucial to ensure the longevity of your treated tooth. And there you have it. The root canal, once a dreaded procedure, is broken down into manageable steps. Your dedication to aftercare can make a world of difference in your recovery and overall oral health. And with that, your root canal journey is complete. Doesn't sound too bad, does it? So, let's recap what we've learned about the root canal procedure. This journey began with understanding the reasons for a root canal, which is often due to an infection or decay reaching deep into the tooth, affecting the pulp and causing discomfort. We then navigated through the two-part procedure. The first part involves removing the infected pulp, cleaning and shaping the root canal. The second part sees the cleaned canal being filled and sealed, followed by the placement of a crown to protect the tooth. The aftercare is just as important. It involves maintaining good oral hygiene, regular dental visits, and being mindful of any changes that may warrant immediate attention. In essence, a root canal is not a dreaded experience, but rather a relief from pain and a step towards better oral health. We hope this video has helped demystify the root canal procedure for you. Remember, knowledge is power, especially when it comes to your dental health.